Good morning, this is Dr. Kassawat, your friendly psychiatrist, and today we're going to talk about the difference between depression and major depressive disorder. Many people, when they talk about depression, they think about sadness, but in reality, depression is just a response to some stimulus in your environment, and not necessarily bad. It can only become bad or a major depressive disorder when it starts affecting your life. What is depression? Well, depression is a feeling of loss of interest, low energy, loss of appetite, or eating too much, and sleeping too much. Now, there's other things that could be part of depression, but not necessarily can be bad. Many think there is an evolutionary advantage of being depressed. And those advantages could be conservation of energy. It also could be a social cue for people to understand that you need some help. It's a time to focus on long-term goals and reflect on problem solving, as well as avoid risk. Now, keep in mind that developed when human beings were living in a very different environment than today. But there's some similarities with the environment today because people do worry. People have a lot of changes around them. They might not be worried about a lion coming to eat them, but they do worry about their job, they worry about other things in their life, children, etc. Now, in comparing depression with major depressive disorder, there's a huge difference because major depressive disorder really has a big impact on your life. And the impact is that one starts thinking in a very erratic way. Example, the loss of interest becomes severe, that one doesn't want to do anything or does not enjoy anything in life. They have very low energy, they don't even get out of bed. They have difficulty concentrating or doing their normal tasks. They have changes in sleep and appetite, sleeping too much, eating too much, not sleeping or eating at all, feeling of worthlessness and guilt. And the most alarming thing are those very dark and negative thoughts about self-harm, either self-harming or thinking about suicide. So dark thoughts, suicidal thoughts, or thoughts of self-harm are a major warning that someone really needs treatment and help immediately. I will keep it short for now. I explained to you the difference between depression and major depressive disorder. If you need further evaluation and in-depth assessment, please get an appointment. But at the end of the day, remember, this is not a clinical advice. It's just for educational purposes only.